Hey guys, this is Mike from PhysioU here with your mentoring minutes. This week we're talking about cognitive and affective tendencies. The low back pain guidelines talks about a category of patients that actually have a psychologic overlay that can reduce their prognosis, to make their prognosis poor, and may lead to central sensitization or generalized pain. So we have to be aware of these patients, and we have to be able to capture when they are demonstrating faulty thoughts, thought viruses, things that we can help to dispel myths in their mind or things that they're worried about. Wouldn't you like to know so that you could address these kind of things and help the patient to have a positive response and a reduction in their pain, perhaps because of their knowledge and understanding? And so I wanted to bring up today this idea of hunting for thought viruses. How can you do that? Should we just leave that up to chance? So think about the new questionnaire that we are beginning to use more of. We're building an app that will have this questionnaire built into it. It's the Brief Illness Perceptions Questionnaire. So the patients are asked to fill out this form that has a number of different questions that I will show you in the next segment. Alright, so here we are looking at the Brief Illness Perception Questionnaire, and you can see that this allows you to get a little glimpse of some of the things that may be going on in the patient's mind, thus allowing you to target your counseling or target your conversations to try to reveal these thought viruses and try to manage them or switch the track for the patient so that they do not continue to catastrophize, to worry, to ruminate about their problem. So if you look here, we'll just look briefly at a couple of questions. How much does your illness affect your life? You can see that these questions are open-ended questions and allow you to, and they don't always, 10 does not always mean worst. Okay, so you have to consider each of these questions carefully. So 10 severely affects my life, and no effect at all. How long do you think your illness will continue? 10 forever, a very short time, 0. How much control do you feel you have over your illness? So this is a control issue. It relates to helplessness. Okay, extreme amounts of control versus absolutely no control. How much do you think your treatment can help your illness? How much do you experience symptoms from your illness? How concerned are you about your illness? How well do you feel you understand your illness, right? Because if they say, hey, I don't understand at all, then in some cases I will spend extra time helping them understand a little bit more about what's going on and what we're going to do in PT to help. How much does your illness affect you emotionally? Does it make you angry, scared, upset, or depressed? And here at the bottom, you note that the patient can rank in order the 3 most important factors that you believe have caused your illness. So here you see the most important causes for me are this, this, and this. Again, they allow you to get a better glimpse of things that you might want to weave into your conversations during your treatments and during your evaluation that you might think might benefit the patient. Remember, knowledge can reduce pain. So, how do you use the form to help the patient with your patient education? So, for example, with Anne here, Anne, I noticed on this form that you just filled out that there are a couple of things that I noticed that you're a little bit worried about. So here you mentioned that you feel like this problem is going to be around forever.
Yes.
So why do you feel like that?
Well, it's because I've had it already for a few years. I have a family history of it, and so I just know I'm going to have it for probably the rest of my life.
Sure. Yeah, I wanted to let you know that actually we're really glad you're here in therapy. We have a lot of different ways to do things with you to help restore your health, to give you confidence in the things that you need to do in your daily life. And I want you to think that my body actually is a very strong structure, and it's always healing. It's thriving. And so part of what we're going to be doing here in PT is to be able to improve the strength and the length of your muscles, the strength of your muscles, and to slowly expand your area of exposure, to try different movements, and to learn how to deal with experiences of what you might think is harmful, pain. But in many ways, pain isn't always, or hurt doesn't always equal harm. So we're going to go through that together as we go through rehab together. The other thing that I noticed on the form is you talking about you feeling like you don't have much control over this problem. I want you to know that, pain is controlled by your thoughts, your brain, and your nervous system is actually your tool. It's a protective tool. And so there are a lot of things that we're going to do together that will give you control over your own problem and give you control over the pain so that you can move forward and do the things that you want to do in life. So I just want you to know that those are some of the things that I understand you're thinking about, and we're going to work together to get you moving and get you back to the things, doing the things you love. Okay? So the Brief Illness Perceptions Questionnaire gives you a little window into the client's mind, into their thoughts, and allows you to have a conversation. Allows you to, in whatever way you see fit, because pain neuroscience education needs to be semi-customized to the patient's thoughts, to their worries, to their belief system. So I hope that this questionnaire will be a part of a tool for you in helping to tease these thoughts out so that you can become more effective in counseling the patient and helping them move forward with good education. All right, guys, this is Mike and Ann from PhysioU. We'll check in with you next week.